Okay, so I would like to talk to you about remineralizing agents. Now, remineralizing agents are basically an agent, a material that comes in usually a paste form, but it can come in a gel form as well. And now they're available to be a reproduction or like a replacement of fluoride. So in another video, I spoke about fluoride and how fluoride is a very, very good remineralizing agent. But because of some questions about safety with fluoride sometimes, and I want to actually remind you that fluoride is completely safe to use as long as it's done in a correct manner. And so fluoride is one remineralizing agent that you need to actually know about, but there are others that are also equally as important. In recent years, there's been two other remineralizing agents that are equally as effective, and they are starting to get more available in toothpastes. One other agent is called Amorphous Calcium Phosphate. Now, it's a very long name, so you just have to remember ACP. Now, ACP is basically a smaller building block of your enamel structure, and it doesn't have fluoride in it, but what's quite amazing is that ACP is basically the same stuff that you have in your bones and your teeth as well. So it's got a calcium and a phosphate molecule, and it basically joins onto your teeth. So imagine if your tooth structure loses a little bit of its structure and you get a mini microscopic cavity. These amorphous calcium phosphates can actually bind onto this area and basically fill in the blanks, right? So fluoride does that, amorphous calcium phosphate does that. And I think the most exciting thing is that, which is the next one, and I love this the most, it's called hydroxyapatite. So hydroxyapatite sounds like a long name. Basically, it's a chemical structure. It's a molecule that is quite large and it's hexagonal like this. And what it is that it's exactly your enamel structure. So if you are using a toothpaste with hydroxyapatite, you're effectively having enamel in toothpaste form. So what you want to do is you just leave the toothpaste onto your tooth that has hydroxyapatite, and eventually your tooth will absorb all this mineral. Very similar to if you have a moisturizer, right? You know, you wash your hands, let's say, and you want to use a hand moisturizer, you put the moisturizer on, and then you leave it on for a long time. Because your tooth, like your skin, we used to think that tooth cannot absorb minerals, but now we realize that they can self-restore, but it works like a membrane. So you want to put something on there and you leave it on for a long time and it will just absorb. So that's why remineralizing agents are so important, because if you use, let's say, a toothpaste that doesn't have any kind of remineralizing agent, so you just take a toothpaste off the shelf that doesn't have fluoride in it, but it says it's all natural toothpaste and no remineralizing agent, then you're basically cleaning your teeth, but you're not restoring your tooth. Okay, you need to restore the enamel structure of your teeth for them to be very, very healthy. And one thing to do with these remineralizing agents as well, they tend to balance the pH in your mouth, which also really helps in the whole remineralizing process. Okay, so remember all these things, because whenever you go to the shops and you're looking for your next toothpaste, make sure that you find out what that remineralizing agent is. See you in my next video.